And so for hip mobilization, you're going to take your strap, we're going to get it nice and big, and we're going to make a big loop. And so if you are someone who has a clasp strap, one that kind of clicks in like a seatbelt, you could just click it in. If you have a D ring like I have with 2 rings, you're going to loop the belt through both rings. And then when you're looping it back through, you go over the first ring and under the second ring. And so that should create a strap that can be snug and consistently snug when we're putting force through it. I like to start with the strap, pretty big in its loop size because you can always tighten it, but it's much harder to open it up once you're there. And then we're going to lie on your back. Now, because we're doing mobilization and we're not doing shavasana, I like to have a little bit of a blanket underneath my head just for some support, particularly if you're someone who doesn't lie on the floor really consistently without support. And so we're going to lie down. And then with the strap, the important landmarks of the strap are the belt buckle, the tail, which is the short end, and of course the loop itself. We're going to start with the loop going around your right leg. It's the leg that is closest to the camera for me, so I can show you kind of how to do this. And so you're going to take the buckle and the tail, and you want that to be relatively close. You're going to put your leg through the loop, and then the loop itself is going to go right in the groin, right? So right in the hip socket. Now you've got the rest of this big loop, which is going to thread around your left foot. And so you can go ahead and do that, but the belt should be relatively slack at this point. You want to make sure when you're setting this up that the tail is handy so that you can pull it tight as you need to. As you're tightening the belt up, again, it's around your right groin and your left foot. I kind of like to make sure that it's around the ball of my left foot, and this takes some finagling. So pause and start the video as much as you need. So I got the loop around my right groin, my left ball of foot, and then I'm going to tighten the strap up as much as I can tolerate it, right? And by tolerating, if you tighten it so much that you have any numbness or tingling going down your right leg, that's too tight. We want it to be snug, but not painful. The other important part is as you're tightening it, that clasp or the D rings should not be in the groin. You want them to be, if in contact at all with your leg, on the side of your leg, preferably slightly below the thigh, so that you have access to the loop, strap, tail, but it's not digging into you. Once you have the strap relatively situated, you're going to take your hands on your right knee and just start to pull your right knee toward you. And you'll start to feel that strap digging into your hip socket. And that's kind of the goal in some ways, or in all ways, really. So we're trying to use the hip strap to teach the thigh bone, the femur, that as the knee comes toward your chest, your femur head, or the top of your thigh bone, which is in your hip socket, should actually go away from you, kind of like a seesaw, right? If one side comes up, the other side goes down. If we think about our thigh as a seesaw, as the knee comes toward you, the top of the thigh bone should go down away from you. And so because you have the strap around the anchor point of the left ball of foot, you can place some pressure into that foot as much as it feels helpful to sort of guide the groin into depth, right? Or more creasing, and help the thigh bone kind of slide away from the hip socket a little bit. Now, of course, if you have like a hip replacement, this would not be appropriate, right? Or if you have a history of hip injuries, it's really good to have this looked at by a PT before you start, tensioning straps around your hip socket with a lot of aggression. For a lot of people, this just gives the hip a little bit of re-education as to how how to flex, how to pull the thigh towards the chest. And in yoga, we flex the hip relatively often, but we sometimes don't include the how as opposed to the place it here, kind of, right? And so again, as you're pulling your knee into your chest, you can press a little bit into the ball of foot and sort of nudge the crease of your hip into a little bit of a deeper fold. And you can monitor that with as much force or as little force as you want to, right? With the understanding that if this is a new practice for you, go lighter more than heavier. Okay, so we're kind of here and we're going to stay here for just a little bit longer, right? Just kind of getting the idea of can that thigh be nudged downwards a little bit more? And you can even play with pulling the knee a little bit out to the side into almost like a modified happy baby pose or external rotation of the hip. And of course, because you have a strap going through the top of your groin, there's likely to be a little bit of discomfort. And so as you're working through this, you want to just make sure that you're still breathing, right? That you feel like you have relatively good control over the amount of force and the placement of your legs. And that if anything feels nefarious or feels a little like there's this thing called the smell test in PT. Like if it doesn't smell right, like be skeptical. If this is starting to smell funky to you, then back off a little bit, right? You don't have to go full force for this to have a good effect, right? You can even think about doing this really lightly, just as a teaching tool, as opposed to a mobilization of your hip joint, and that could be great. And so now we're going to switch sides. So I recommend grabbing the top of the strap with your hands, placing the ball of your right foot in the loop, and just simply transferring legs. You may need to adjust the tension of the strap depending on, how it feels or if the strap slid a little bit. But oftentimes it can be a nice transition just to get right into the second side without a whole lot of kerfuffle. Right. And so now we've got the strap around the top of the left groin and the ball of the foot pressing into the kind of lower end of the strapped loop. And again, you've got the tail relatively close. So if you need to pull that tail to tighten the strap, you can. And making sure that the buckle is, again, away from the areas that are most compressed, which is kind of the inner groin and the top of the hip. And so then we're kind of just nudging the thigh bone up as the strap is pulling the thigh bone down, right? And it's kind of tricky to think about, especially if this is a new concept, how the thigh moves. It can be very confusing because we often think of the joints moving as opposed to how the bones position to allow those joints to move. And so again, if you think about the long bone of your femur, it's a straight bone, relatively speaking, right? There's some angles in there, but relatively speaking, you can think of it kind of like a plank of wood. And if it was a seesaw and one side went up and one side went down, they would have to act in opposition because the wood is relatively consistent and strong, as is bone, right? Bone is relatively consistent and as strong. Of course, there is turnover, right? Bones are consistently kind of replacing themselves, but for our purposes, it's somewhat static. And so as your knee comes toward you, so that's the end of your femur, right? The top of your femur goes away from your hip, right? And that gives you some space in the joint so that you can slide and glide as opposed to pinch and impinge effectively. And again, if this is feeling really sensational to you or confusing, this is something that a physical therapist could be really useful for, because there is a lot of people out there with that pinching in the front of the hip, and there can be many reasons why that pinching happens. And it's really nice to have a therapist look at that for you if it is of interest, or particularly if it's concerning. If you turned your leg out on the first side and you haven't on this side, go ahead and kind of play with some angles of where your knee is pointing. And of course, my bias is always going to be more from the physical therapy and yoga perspective, because those are the professions that I work in. But I do think sometimes we assume that yoga can fix things, and yoga can do a lot. But I think it's really important to just remember that yoga is a particular practice, and sometimes we need someone to look at our movement patterns and our joints and whatnot to make sure that the practice is doing the best thing for us, right? All right, so now go ahead and remove the strap off to the side and just let the feet come down onto the floor so that they're relatively parallel. You can place your hands on your torso or even out to the side if you like, and just notice with the legs bent and the feet on the ground, what are the residual sensations for you? Right. We're doing this before straightening our legs because it's usually a little bit more of a gentle exiting pathway from that mobilization, but you might feel some different lightness or heaviness than before. You might feel some, sometimes almost like a feeling of blood rushing, right? Hopefully the feet did not fall asleep during the strap work, so that there shouldn't be a coming back to life, of that pins and needles. That should not be happening, right? If it is, you may have gone a little far. And then go ahead and let the legs lie flat on the ground and just kind of see how it feels for the legs to be relaxed, right? They don't really have to do much here. Notice if the feet sort of flop out to the side. And if you're someone who has a pretty clear sense of your habitual nature when you lie on the floor in this kind of shavasana like posture, you might notice if it feels really different after doing that hip mobilization.